One of the other things that many of my patients come see me about is issues of infertility. Many women think that because they decided to now start having a family, they would get pregnant in 1 or 2 months. And that's usually not the case. So a lot of women come see me for real, valid reasons of infertility. They've been trying for a year and haven't been successful in conceiving. They've done research and they're doing everything that they can. The vast majority of cases of infertility, it is something that can be explored and diagnosed in an office setting with relatively simple, non-invasive tests. For example, when a couple comes to see me for the first time and they actually have a real case of infertility, one of the first things we do is we do blood work, and we take a good history and physical, and we try to find out if there's anything that we can find just on a cursory, relatively detailed examination. Many times we can do the blood test and find out that it's a hormonal problem. We can add hormones, or maybe many times we find out that the problem is not infertility per se, but the problem is with their periods. Maybe they're not ovulating every month. One of the things that a lot of women and men don't know is that 40% or thereabouts of infertility is actually from the male side. And one of the easiest tests that we can do is a sperm analysis. And we usually do that combination of an annual exam, lab work on mom, and as well as a sperm analysis on dad to try to find out what the cause is. If after we do this, then we start stepping it up to more invasive, if you will, forms like radiology tests. And in some cases, almost 20% of infertility is unexplained. And in those cases, we will refer patients out to some of the local, very well-established infertility groups. They can proceed with other things like in vitro fertilization and things like that. I've been a physician since 2001, and my area of specialty is obstetrics and gynecology. And what that means is that it covers the full gamut from the early teen years of women all the way through postmenopausal stages, including pregnancy.